Let's come back to India. There's no peace from the pandemic here. The second wave is slowly subsiding, but another challenge has emerged. It is called Black Fungus. From reporting just a few cases last month, India has now been forced to declare this infection an epidemic. The situation is serious. Where are these cases being reported? What are the measures being taken? And what are the challenges in India's fight against the black fungus? Our next report explores.
हमारी इस लड़ाई में अभी इन दिनों ब्लैक फंगस की एक और नई चुनौती भी सामने आई है। इससे निपटने के लिए जरूरी सावधानी और व्यवस्था पर ध्यान देना जरूरी है।
The Wuhan virus cases may be falling, but there's a new cause of worry. Black fungus, scientifically known as mucormycosis. It is a complication associated with the virus. A few cases were reported in New Delhi last month with no loss of lives. Since then, the infection has killed at least 219 people. The case count has reached 7,250, with infections reported in at least 13 states and union territories. The worst hit are Maharashtra, Gujarat, Madhya Pradesh, Haryana, Delhi, Uttar Pradesh, Bihar, Chhattisgarh, Karnataka and Telangana. Given the scale of infections, the central government has directed all states to declare black fungus as an epidemic. The Health Ministry has asked them to list it under the Epidemic Diseases Act 1897, which basically means that every single confirmed or suspected case will directly have to be reported to the Union Health Ministry. All hospitals, state and private, will have to follow guidelines for screening, diagnosis and management of cases. Are they prepared? Not really. Several hospitals across India have reported a shortage of amphotericin B, the medicine which is key to curing this infection. The centre says this shortage will be resolved soon. So far, 6 pharma companies were producing this drug, and now the centre has given permission to 5 more manufacturers. It has also placed orders to import 6 lakh vials from abroad. The rising cases and shortages have caused alarm. But it is important to understand that the fungus doesn't infect everyone. So far, it is only being reported in some COVID-19 survivors. Doctors blame the panic use of steroids, which made it easier for this fungal infection to spread. But how does it spread? Mucormycosis is caused by a group of moles called mucormycetes. These moles exist freely throughout the environment. People get infected when they come in contact or breathe in these fungal moles. So who is the most vulnerable? According to the Indian Council of Medical Research, 4 kinds of people: those who use steroids during their COVID treatment and end up with lower immunity, those who had prolonged stays at hospital ICUs and are yet to recover, those with diabetes or a history of kidney and heart failure, and those who are on medication for major health problems that reduces their ability to fight pathogens. What are the symptoms? Pain under the eyes, one-sided facial swelling, nasal or sinus congestion, black lesions on the nasal bridge, stuffy or bleeding nose, toothache or loosening of teeth, and partial loss of vision. How do you protect yourself from such an infection? Experts advise the following steps. Wear a mask at all times. Wear shoes, long trousers, and preferably gloves if you step out into a park or for gardening. And maintain personal hygiene, including a thorough scrub bath. As infections rise, India must focus on precautions, judicious use of steroids, and immediate treatment where the fungus is detected. Bureau Report, WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.